get their attention. Now, when I start out, I say, we find most people that come to a chiropractor's office don't know what chiropractors are or what they do. Most people have a vague idea that chiropractic's a way to get rid of a backache or a sore neck or a sore shoulder. And while it may be true that those things go away under chiropractic care, that is never a rational reason to visit a chiropractor. Chiropractic's not about your sickness, your disease. Chiropractic's not the treatment of anything. Chiropractic is all about living longer and living better, about the quality and quantity of your life. That gets their attention. That makes them sit up and say, oh, I thought I was going to have some talk about the mechanics of a backache. But that's not what this guy's going to talk about. He's going to talk about the quality and quantity of my life. That sounds like it might be important. I think I'll listen. Get their attention. Establish innate intelligence. I call it life force. Life force is a more flexible word when you're lecturing lay people, I think. But you could use them all, obviously they're interchangeable. You're going to build a nervous system, obviously, and show how it's an essential part of creation. And talk about the egg and the sperm coming together, splitting into 2 cells, 4 cells, 60 cells, 2,000 cells, eventually producing the notochord, ultimately producing the nervous system. And then at the end of those nerves occur small buds that become future glands, organs, and tissues. You then show the body growing under the direction of innate intelligence over the central nervous system. Finally, the spinal bones grow, and you wrap them around the spinal cord, and then you demonstrate a vertebral subluxation. What I really like is take a small 3-section spine, stick their pinky into the intervertebral foramen, and twist it. It's an object lesson. It'll pinch their pinky. You say, I suppose I'll leave your pinky in there for 3 or 4 days, or a month, or a year. It's going to happen. Honestly, they're all red and swollen and inflamed. And later on, it begins to atrophy, begins to wither and die. In either case, it certainly isn't working right. Well, the same thing happens to your spinal nerves. When a vertebral subluxation occurs, it causes those nerves to diminish in function. When they don't work right, guess what? Whatever they control doesn't work right. Simple, hard bone, soft nerve. Now, we talk about causes of vertebral subluxation. This goes back to what brought you to my office question on the original questionnaire. The causes of vertebral subluxation. If somebody says he's a stamping machine operator in a machine shop, stamping machines have these huge levers, and you pull up the lever and it opens the jaws. You slide a piece of metal in there, and then you push it down, and it stamps. Now, if the guy does this kind of work all day with one side of his body, what do you think might happen to his shoulder? Might get a little sore. Now, I know he's a stamping machine operator because he told me way back in the form. So I'm going to say, do you think that might cause a vertebral subluxation? Yeah, I can see how it might, Doc, yeah. Demonstrate the results of a vertebral subluxation. When a subluxation occurs, there's a decrease in life. This is philosophically incorrect. Accept it. It's what is easiest to explain to people. You want them to walk out with the best possible comprehension of what it is you do that you can give them, and it may not be philosophically perfect. We then talk a lot about dis-ease with the hyphen and how that separates us from everybody else. Osteopath, physical therapist, medical doctor, rolfer, massage therapist. All of them are therapeutic. All of them are treating diseases without the hyphen. We're the only people who correct the cause of dis-ease with a hyphen. Dis-ease, lack of ease, lack of harmony, lack of coordination, lack of the ability to adapt to your environment. People die because they can't adapt. That's how we reverse that. We make you more adaptable. What do chiropractors do? They locate correct vertebral subluxation. Who needs chiropractic care? That's where you go into the spiel on kids. Now, I might not go into the spiel on kids if I'm talking to 2 young kids who are not yet married, do not yet have their own children. I'll just passing mention now. Kids, this is an old Reggieism. Kids fall 6 times before they get out of bed in the morning. Toddlers. They do. Do they need chiropractic care? Of course they need to be checked. Who needs chiropractic care? Old people, new people. Everybody with a spine. If you've got a spine, you need to have a chiropractor. How long do I come? How often do I come? Right there, right up front. The rest of your life. How long would you like to be unsubluxated? We've now created in them a trepidation about subluxation. Now we say, how long would you like to be unsubluxated? Forever? So you get your spine checked forever. Because you're going to go home and do the same stupid things you did to subluxate the first time. Well, why don't you come home with me and show me what not to do? Because there are millions of those things, and I haven't got that kind of time, and you couldn't afford me. Then we go into fees. I go into GPC. Chiropractic belongs to all of you. Chiropractic is the way you've been given to live longer and live better. I'm a chiropractor. It is not mine to sell. We created a fee system that I believe enables everybody who needs care to receive care. So when I asked you to bring your husband with you or your wife with you, I wasn't asking you to bring me more new patients so I can make more money. Because your fees aren't going to alter whether your husband comes in or not, whether your wife comes in or not, whether your kids come in or not. You're going to set a flat weekly fee for care that's consistent with your ability to pay. If all this talk about life and death is true, then how do we set a fee on saving your life? In the adjusting room, you'll see later if you become a patient, and we reiterate that. Even at this late date, they may not become a patient. Want them to feel free to leave. I'm going to give them every chance to leave. Then as soon as they're sure they want to stay here, the guard dogs come out, the machine guns get brought out, the gates fall down on the windows, and they're mine, as I want to say.
Have you had people say, I don't want to do this for the rest of my life?
Sure.
And then they leave?
Sure. But 49 years, maybe a hand, maybe 5, 6, 7.
But you have attitude.
So do you.
Take it till you make it.
I need to balance it though.
That's right.
That's why you're here. That's why you're here.
What?
No,
That's why you're here. You're in the right place.
Yeah,
No,
absolutely.
Joe.
You don't want to go. You don't want to
Someone
go
just
from one
like
extreme to
says-
the other and hurt somebody. No.
Well, I understand what you're saying, I really like it, but I don't know if I want to do this the rest of my life. Can I just come for a couple months?
No.
You say no at that point.
Why?
I keep 10
Well,
grand.
yes, why?
10
Why
grand.
should I? Hey, look,
Today,
I am a
10 grand.
supremely kind, giving human being. What I'm doing here is unheard of. You ever been to a doctor who didn't have a fee? Well, it's not. I am saying I'm willing to take care of you for $1. I'm willing to take care of you for free. That's how important this is. And you want to throw that in my face? Screw you. don't let the door hit you in the ass on the way out. Attitude.
But not those words.
Not those words, no.
But it's.
But once in a while,
There's implied, there's
Once in
an
a while.
impliement through your confidence. Also, we talked about limiting beliefs earlier. What people tell you 90% of the time is totally not true. They have a limiting belief, their mind has memorized a pattern, and they say that when they don't want to think about something. Like, what, or they're testing, I just want to come in this, I just want to do that. And what's happening is a few different things. One, limiting beliefs, and second, they're seeing who's really in control. Joe's gonna let you know, I know what you need, I'm the one who's the authority here.
Forgot to give you those. After on the first visit, when they leave with their appointment, come back for the orientation, that goes through them with them. It's an explanation of the fee system, basically. Anybody who doesn't want what I'm selling's gotta be nuts. And I mean specifically me, because I'm the best. I'm better than all of them. That's just an attitude. You have to, look, if you're gonna make it in private practice, if you're gonna make it in a entrepreneurial, small business, you better develop that attitude. You've never met an entrepreneur who doesn't have that attitude. If you don't develop that attitude, you're not gonna make it. You're just not. You're gonna work for somebody else the rest of your life. And me, I didn't get into this because I wanted to work for somebody else. My father was a blue collar worker. He always told me as I was growing up, Joey, get into some business where you don't have to use your back because your back wears out, and where somebody else isn't your boss. We've got freedom. Great advice, Dad. Great advice. So, we then take him into the adjusting room. The husband, the wife, whoever's with him. In the adjusting room, the wife, let's say, is the patient. We stand her on the foot piece of the zenith high-low, and I say, okay, Mary, your subluxated here, atlas, over here, axis, fourth dorsal, 10th dorsal, fifth lumbar. Would you like to fix those? You want to be unsubluxating, Mary? Yeah, you bet. Table starts going down, hit the button. As the table's going down, I look across the room with the man, the husband, who's sitting in the chair, and say, okay, Mrs. Smith, when are you going to get your spine checked? We've come to the moment of truth. Oh, I work all day. I can't come in except at night. No problem. We're here at 6 to 9. What time would be convenient for you? 8 o'clock, 7:30. He gives you a time. Write it on a little card, give it to him. He's got an appointment. And then you look at Mary and say, Mary, next time you come, why don't you wait till the kids are home from school and bring them with you? And we can check their spine. Now, I don't take x-rays of children, I would say. That's when I used to take x-rays. I don't take x-rays of children generally unless there's some good reason to. So you can just bring them with you on a future visit. And sure enough, Mom comes in, she hops on the table, she gets checked and adjusted. The little ones hop up there, you turn it into a game, you play one of the popcorn games, which is fine, and check them out. If I think they really need care, I might see them twice a week. Generally, once a week is fine to start with them, because they've only been subluxated for 5 years, or 6 years, 2 years. And if all goes well, they leave the office, and I've got 5 new patients. Husband, wife, and 3 kids. Well, was it 2?
Yeah.
4 or 5 new patients. And if there were 3 of them that week, I've got, 12, 15 new patients. Do that 4 weeks a year, 4 weeks a month. And you got 50 people a month that are coming under care. They're coming in 3 times a week, so it's 150 visits a week. But it's just these new people being cycled in. You got another 150 that are your regulars that are coming in once a week to get the spine check. You're seeing 300 a week. There, wasn't that easy? 300 a week. If they pay you $10 a head, that's $3,000 a week. This kind of practice has no overhead to speak of. Overhead should not be any more than 10 to 15% of your growth. Now, home office makes that real easy. But even in a paid-for office, you can still pull that off. Try and keep your numbers down. You're not working to make your landlord rich, you're making to make you rich. So you're making $3,000 a week. Let's say 300 of it goes to overhead every week. That would be $1,200 a month, which is close, maybe around $1,500 a month, might be more realistic. And you're making $2,700 a week. Could you live on that? Sure. Let's say it's not 27, say it's 2,000. Welcome to the club. Questions?
I do, Joe. When, and this is, as longer I'm in practice, I'm starting to see this. You start in children, maybe they're newborns when they come in, or they're a year or two old. Is there a point where you think they're old enough to appreciate the orientation and then give them the orientation?
Yeah, you should.
You should,
right? I never did.
Right.
Always regret it.
Yeah, that's the issue that I've kind of been coming across. Some of them are teenagers and they're like, they don't fully understand why they're here every week with mom and dad, but they don't fully understand why. So I didn't know if there was an age.
The
that you thought was
regularity of
best.
it seems to carry through.
Right.
I've got an awful lot of them, see, a lot of those pictures are now grown-ups with kids of their own. So I think a bunch of them will just continue
It's the habit.
without it.
Yeah.
But it would be awfully nice to know they're going out into the world,
And telling
because they're gonna move to Ohio where their jobs are starting. You know, an awful lot of them will at least have an idea why. And I always missed the boat on that, and I'm sorry I did. I think if you could work that into your life, into your schedule,
All right.
um,
I didn't know if you had like a
maybe
magical
day,
age. Yeah.
maybe a family day at the office, you know? Bring everybody in, shuffle the kiddies off into one corner, and give them a little cookie hard bone softener,